It's an honor and a pleasure to be here with you guys today. Thank you so much for coming out. I know it's a lot of information that has been discussed by Dr. Silverman. And Tennille, thank you for calling out the many years that I've been doing this. It's been a long time, and I actually was recruited by Dr. Silverman and Dr. Holland from the open heart surgery area. And when I started working with them, within the same month, my grandfather was diagnosed with MDS. So I have a very personal connection, very close with my grandfather, many years ago. So we've come a long way in understanding the disease, looking at options, and so I'm going to walk through a few slides. And, how do we manage the disease and the side effects, improving the quality of life, as Dr. Silverman had mentioned. Very important to us is to make sure that you're living the best life that you can as you're facing a very challenging disease. And so, a long time ago, it was really just a single step in trying to figure out what is Myelodysplastic Syndrome. It is a pre-leukemia, and it is small steps that we've had to take, but we have made major advances, as you can see with all the information that was presented to you today. So a long time ago, there was only one drug that was being used, which was erythropoietin, stimulating the bone marrow and the red blood cells. It wasn't really an active drug therapy, if you will, to change the natural history of the disease. Like my grandfather, he had to have transfusions constantly. He had basically all 3 cell lines were affected. So he had low blood cell counts in his white count, so he was prone to infections. He required blood transfusions every 2 weeks, and it increased as he became sicker. And his platelets were very low. So many years ago, no one really knew what it was. It was just a form of pre-leukemia. And you were basically told, don't worry, we're just going to watch and wait and see and give you just supportive care. And so at that time, patients were without hope. And here I am, a nurse, and I'm like, there's no active drugs available. We were doing all of the work in azacitidine at the time. And because my grandfather had other underlying issues, other what we call comorbidities, he was not eligible. To learn about the behavior of drugs on our bodies, it's important to have healthy patients and healthy people so we can, have it across platforms so we can see about response. And so it's very important that, that you understand that it took years in order to get azacitidine on the market and available. So here's hope. We have to have hope. We have to believe that, these more and more drugs are going to become available. We want to use what we have correctly, efficiently, so that you have the best option in getting a response. So we're going to talk about having patience, and that's where Dr. Silverman was mentioning how long it takes for the drug to get into the bone marrow, get into changing the bad seed, if you will, and getting normal cells to grow. So as a noun, it describes that feeling that what you want can be had, or that things will turn out for the best. And as a verb, it means to look forward with desire and reasonable confidence. And I think we can, say that now that, there's a lot of hope out there. These are quotes directly from patients from lots of forums like today, that they have written down. And I'm sure that there's, some of these statements here that you can relate to. Having a diagnosis of any chronic disease, it's very overwhelming, very scary, but your whole life changes and that of your family. My grandfather was very frustrated in that he lived outside of Manhattan in New York City, and he lived in a 4th floor walk-up. So he would often have to sit on the 2nd floor stairs, catch his breath, get the energy to go up to the next 2 levels. But that was an assessment on how he was feeling. He would just say, I need a blood transfusion. He didn't need to get his blood drawn to know that that's his criteria. So when you're making assessments and having honest conversations with your doctor and your nurse, you want to figure out how are you feeling? How are these things impacting on your overall well-being and on a daily basis? Lots of it is that people look at you and they have no idea that you're sick sometimes. I mean, you might look pale, you might be a little bit short of breath, but they say, I have no idea what this disease is, but they wouldn't even know that you look fine. And it really is the fear of the unknown, not, what to expect next. This patient says this very eloquently. As a patient, it's crucial to take responsibility and have the courage not only to ask, but also understand. So what I really stress is that I understand that it's very overwhelming and it's very scary listening to a lot of this information. But when you embrace that knowledge, it empowers you to just say, okay, I can understand this a little bit better. You're going to start, when you get together with other patients, have conversations, share stories, you do feel better. Work with your family and your friends, just so that you know that you are centric to everything that we do, and that when we're making decisions, as Dr. Silverman had said, it is individualized and personalized for every patient. It's very different depending on whether or not you have other physical issues that are going to be factored into the decision of why we're going to start a particular therapy, when we're going to start it, and how we're going to do it. And it's so education and a lot of research and a lot of monitoring will go on with a whole host of members of your MDS team and managing your care. So don't feel that any question is stupid. It's important to write these things down, and my slide deck will go through that process of really making notes and making sure that someone is with you at all your visits when possible. Because I think that there's so much information, you can only absorb so much, and they can be a support system. So what you want to do is it's basically standing up for your health, which means being a strong self-advocate and an empowered patient. It means taking a more active role in your care to ensure that you or your loved one will receive the best care and treatment available. And you can give back a sense of control when you do that. So we have 5 pillars that we're going to discuss, and this is available also on the aamds.org website, and you can see what standing up for your health means. We're going to go through each of these pillars. Build a strong healthcare team. Learn about your disease and treatment options, make the most of every office visit, very important keeping a careful track of your health information, and build a strong personal support team. So when we talk about the first pillar, build a strong healthcare team, what does this mean? It means, as Dr. Silverman was saying, is that you want to really get with a specialist, a hematologist that understands this disease, and you want to be able to feel comfortable that you can have an open conversation about what are the issues and the concerns that you're facing. Depending on where you go, you're going to have a whole healthcare team. You're going to have a nurse. There's a pharmacist that's involved. You may or may not have a nurse practitioner that'll be seeing you, or a physician assistant. We have what we call patient navigators also that work in the practice, and a social worker. So also you might have a psycho-oncologist or a psychologist. So you want to make sure that you're discussing everything with your team members so that we can help guide you and give you the best direction and get the support that you might be needing. What kind of questions might you ask when you're going to get, so you're going to be prepared in meeting with your healthcare providers. As Dr. Silverman had mentioned, do you know what caused my MDS? This is very frustrating for patients because 90% of the time we don't know. And we want answers, why and how. I have no idea why my grandfather had it. He worked in a chocolate factory. They made gum. But he was exposed to a lot of those dusts and powders and things like that, never wore masks. Did that have anything to do with it? It could have been, who knows? But you do want answers. What are your options about transplant? Why are you recommending a particular treatment? Think about what are your burning questions, and we'll go into that a little bit more. Pillar 2, learn about your disease and your treatment options. Knowledge is a powerful part of self-advocacy. This is a very complex group of diseases. You need to learn all that you can about your condition and the available treatments. You have the leukemia.org as a starting platform that will give you links to specific information, and it's trustworthy and reliable. As you know, the internet can have a lot of wrong information. And so it's important that you go to the right areas. And I know this is a very complex slide with a lot of information, but it is individualized treatment. Why we start a particular therapy is your transfusion dependency so great that you really need to have an active therapy, that you're no longer on watchful waiting, that you have iron overload issues, and that you're getting chelated, but now we want to stop that, decrease your transfusion burden by starting an active therapy. Do you have high-risk disease or low-risk disease? Now, my grandfather could have been had this disease for a lot longer than we ever knew. And so he could have been a low-risk disease patient for a long period of time. But when he finally, he was very active. He was very involved in his church. He walked everywhere. It wasn't one-stop shopping in terms of food shopping. He would go to his bread and butter store and eggs and milk. He was very ethnic, in an ethnic area where, you go to the butcher, you go here, and he walked everywhere. So it was when his fatigue was so great that he said, you know what? And I said to Dr. Silverman, my grandfather's complaining of all these symptoms that we're seeing with our patients. Will you see him? He does a bone marrow, and that's how he's diagnosed. So what drives you in there? So it's very important to keep a track of how you're feeling overall throughout your care. It helps and gives you hope when you know that maybe your blood counts are low, not as where they, you would like them to be when you started therapy, but you're starting to feel better. A number, that's a number, but when you start to feel maybe that internal fatigue going away and you feel like you're more engaged and involved in some of your activities, those might be early stages of you responding to treatment. Also, how often are you getting your blood transfusions? Blood transfusions just don't stop overnight. They lengthen over time. So if you were receiving transfusions every 2 weeks now, it's now every 3 weeks. It's slow progression. You're starting to improve. You want to have that hope, and it's sometimes not so easy to see. Duration. 6 months of treatment is often required, and that was really, really important. We had a lot of science presented to us today, and to me, as a nurse, that's the most important for you to understand. It is evidence-based medicine. There's science behind what we've learned, where we want to go forward with the field, but why we're saying it's important to have 6 cycles. In the beginning, when the drug was approved, we said 4 cycles, because that's how the study was written. And then we learned that 30% of patients responded after getting 2 additional. That's a large number, so that's why we're saying 6 months of treatment. And then you want to try to track and see how you're doing on that treatment. So as a nurse and as physicians, we're going to do that within the practice, but you can also do that yourself, and I'll show you some of the material that you can use to help you get through that. I know that this was scary to hear, that when Dr. Silverman was mentioning that things get worse before they get better. And so I'm going to go through some slides to just show you what is going on in the bone marrow, but we have we feel very comfortable with all of the patients we have treated over the many years that, as Dr. Silverman had mentioned, it's the disease that causes the problems. It's not the drug. So you have bad cells in your body. Those cells have to be killed off. You're going to, lower your counts, and why that drug gets into the bone marrow, and then new healthy cells start to rise and improve in your bone marrow, and then improve in your counts and get into your bloodstream. So then when you get a blood test, you can see that that is improving. It does take a little bit, time. That is the most difficult, the first 1 to 2 to 3 months before that activity is realized. But again, we really want to push it out for 6 months. And in between here, we're going to give supportive care. You're going to get your transfusions like you were getting if you were not having on any therapy. You'll get antibiotics added if that's what is necessary. And if you need a platelet transfusion, if that's important. So things like that, we're going to do throughout your care when needed. So again, communication is essential when you're not feeling well, or if you're running a fever, you know that you need to contact your physician and the nurse. So here's one of those science slides. And what I really want you to focus on is what we were talking about. Things get worse before they get better. We do expect your platelets to go down and your white cells and your red cells to go down. But look at this. This is, 24 cycles. That's 2 years worth of treatment. So your body can handle that. Your bone marrow can handle that. So things get better over time. So it's the first 1 to 2 cycles. And so in the beginning, we know that your counts are dropping because the disease is bad. It is ineffective blood cell production. And so when you start treatment, you're going to see this dip. As treatment cleans the marrow, your blood counts are going to drop. It's almost like a roller coaster. You're getting this big dip, or what we call a nadir. And it's during this period of time that you're going to be in, tight communication with your doctor and the nurse, and we're going to support you through that while your counts are very low. You might need more transfusions in the beginning. That doesn't mean your disease is getting worse. It's just that we're going to, support you through that while the drug has some time to work on your bone marrow. Then you start to respond. You start to level out. Your counts start to become stable. They might start to improve, after 3 cycles of therapy, 4 cycles of therapy. And then you get to be weaned off your supportive care. You no longer need transfusions as often, and hopefully become transfusion independent. These sinusitis, the chronic infections that you were getting are going to start to go away, because now you have good, healthy, normal white blood cells that are functioning in your body. So it's important just to remember that it is just early toxicities. This is where it's discouraging for you. You're on the radar screen for us. We're going to help manage you through that. Don't give up hope. Realize that this is what we expect. The drug is doing its part. It's getting in there, doing what it needs to do. And so it is time that is required, supportive care. So really setting the expectations. I think that when we tell you that, your fears kind of go away. This is what we want, we expect to see. This is not a bad thing. This is actually a good thing for us. So it is just this period of time that we want you to have some patience. So make the most out of every office visit. Set the agenda for the visit. Ask yourself, what do I want to get out of this particular visit? Write down the top 3 things that you want to discuss. Time, is obviously, it's difficult for your physician to spend a lot of time with you, as well as the nurses. It's very busy. But think about what are your issues and your concerns for that particular visit, and write them down. You're not going to remember. You're going to get distracted. We all do. Focus on that, and bring that information with you. For your next appointment. You might not but go to see the physician. You might get your blood counts watched locally and then come see the physician, but once every 3 weeks, or before you start your next therapy. So make a list and have that available. Write a diary down. It's very important. Remember to bring to the doctor anything that's changed since your last visit. Did you get a transfusion on the outside? Did you see did you see a cardiologist or an internist? Did you go to the dentist? Very important to really discuss that up front. Dental hygiene is so important, but it's really, when you have a very low white blood cell count or a neutrophil count, very important to discuss that with the physician first before just going to the dentist. You might need antibiotics before you go, to make sure that you're not going to have any problems. Make sure that you bring any medications that have changed, and to discuss, when we're talking about prescriptions, that's prescriptions, but we're also talking about herbs, vitamins, and supplements. We all have friends that are always like, I'm trying this new cocktail that helps your liver cleanse out, and, all these great things, or St. John's worts, to help if you're struggling, with, that helps with depression, but it also impacts on your bone marrow in a bad way and can have interactions with your platelet count. So they might sound, herbs are very medicinal, so full disclosure on that, very important. Note any, symptoms and side effects that you're having that are different. And again, remember, did you see the eye doctor? anything going on here. And transfusion records, important. That's your baseline. How transfusion dependent are you? Is it determinant if it's getting worse that you might need treatment, or once you start treatment that they're lengthening, that you're actually starting to improve? So again, giving you hope. Always listen carefully to the instructions, whether or not you don't like to hear, no, you can't, no, you can. There's a lot of times that we like to say, yes, you can, but remember that it's only for your best interest, that if your physician is guiding you that you can't go away, or you're very, your counts are very low, and that you can't go on a trip that you wanted to go on, or your grandchildren are coming in to visit you, you have to be careful. But it's very important. I know that you want to spend less time with your physician and your healthcare team and more time with your family, but if you're running a low-grade fever, low-grade fever and a no white count is a very bad combination. So when he says call, you need to call, or if you're having, chills and things like that, very important to make that note of how to get in touch with the office. If you're running, if your counts are getting done on the outside, that your transfusion appointments have been made and that you do show up and you get those transfusions. Pillar 4, keep track of all your health information. A lot of information. Being organized also is very helpful. Take notes. Again, we went over all of this information here about listing your medications and transfusions and any instructions that, in terms of the medication, if you're taking lenalidomide, it's an oral pill, to be compliant when you have to, take that medication, very important. Any system works. You can, whatever is useful for you, and there's stuff that I'm going to show you that is available on a website that you can fill out, and other tools that you can use. You can just put it in a binder. You can have electronic files. Patients create spreadsheets and graphs and they see how they're doing. Anything, a journal, a book, but there's a lot of online and electronic health records. And are you able to access that? In the United States, we can get onto our own electronic health record, and we can see our counts, and we can actually send emails to our care providers as well if we have questions. Also, Pillar 5, a strong personal support team. Your support team is your family and your friends. Make a list of things that you need help with. You can always pay them back by, baking something, cooking something, doing something that they love. We all help each other out. But it's really important to seek that out. We all need support. It's very, very important to get through what you're getting, having to do. And I understand it's a lot of time and energy to go to frequent doctor's appointments and ask your family and your friends and your kids to take time off of work. And but they would be doing the same thing. You would be doing the same thing for them. So it's important to enlist everyone. There's calendars and different things. This is a website. It's lotshelpinghands.com. And this is a really nice calendar that is actually electronic. So kids from all over the place, friends, can get on, and it's virtually updated. It sends reminders, helps coordinate all kinds of logistics. So if it's somebody that you need help with the food shopping, or if somebody can come and do laundry, or if somebody can come and, when you're not feeling so great during the week of your treatment that you need rides. If you get on there, it's very, very easy. One person just sets it up, and it only takes a few minutes to create. I've done this as well, and I'm actually, several people have emailed me that I've sent it off to that are not doing well, and they said it's really is amazing. Friends and family can check to see what they can do and how they can sign up. It's very flexible. Changes can be made without any problems, and it's virtually updated right away to everybody. I wanted just to touch upon the, caregivers. And so anyone that's taking care of anyone that has MDS or just any illness, it is overwhelming. Your role is you have direct care. You provide emotional support, and you have indirect care. So you're, lots of activities going on here. For the direct care, you're monitoring, reporting, recording treatment side effects. You're helping out, that journal. You help administer medications. You decide whether to call the physician or not when, the mom or the dad or the brother or the sister, whoever it is, or the friend doesn't want to make that phone call. You're in their best interest actually doing that for them. There's a phrase that we often use. We call you guys the truth squad, because half the time when the physician is asking the patient, what's going on, how are you feeling, everything's great, this is good, and then you have the truth squad behind going, no, wrong, this is happening, this is what's going on. So you're there. You're also, in an indirect way, dealing with transportation, dealing with the household maintenance, dealing with financial stuff, very, very overwhelming, and then you're balancing out everything else with the emotional support. You have to take care of yourself. You have to realize that together as a team, this burden falls to both of you. And so you have to take care of yourself and realize that your health is just as important. You need to be strong, you need to be healthy, you need to go for your appointments and your checkups. And that's the last thing that usually is on the list. But it is important that we realize that as a society, we are living into our 90s. And so living a very long life, and we're taking care of parents, and we're working full-time, and we're taking care of our kids. So very important to think of yourself as well in the equation. So what can you do to stay healthy and living well with MDS? So let's look at some of the stuff for quality of life. Quality of life is defined by oneself. What is quality of life to me is very different for you and everyone else, but it is, and it's something that changes. It can change from the day to the next. What you think is a priority today might not be a priority to you tomorrow. You have to think about that and set those goals, and then bring that list to the doctor and say, these are my concerns, these are my worries, these are my issues. This is what's impacting on my quality of life. My grandfather didn't have a quality of life at all at that time, because he was, I would get off of work at that time, I guess, they just were constantly doing transfusions in the hospital. So I'd get off of work, bring him there. He'd be in the hospital all day getting blood transfusions, then come home, and it just there was no life for him. So we have to define that for ourselves, and it's based on our own values and our own culture and what's important to us. And so you need to do things for yourself that are important to you. Remember, you have to live with this disease. It is very overwhelming, it is very frustrating, but you have to find some balance of happiness. And it's very difficult, because I think that when when your white count is low, and you're, afraid of bleeding issues, and everything is overwhelming, you become socially inward, and you don't even want to go out and you want to see friends. You have to try to do that. You need to find some kind of balance to just try to get together, have lunch with somebody, things that make you happy. It just helps dealing with things in a whole different way better. And so when when you talk about what are some of the symptoms that impact on quality of life of patients with MDS, Dr. Steensma had an online assessment survey that he had done a couple of years ago. But the biggest problem is, and you can all attest to this, is the extreme fatigue. Excessive fatigue was one of the large percentage of patients, over 350 patients. Bruising and bleeding issues. Believe it or not, night sweats, and that is known, fevers of unknown etiology is also part of this disease, but night sweats. And so, again, I talk about risk of social isolation from neutropenia and fatigue. We have to find a balance between, prevention techniques, washing hands, staying away from people that are sick. But go to the movies. If you want to see a movie, you can go to the movies, but go in a matinee where it's less crowded, in a place that you would want to, that you can go to, but then just be careful. But you do have to try to do some social outings. Very, very important. I think that definitely a balanced diet is very important. There's no one particular diet, but it is balanced and it's healthy. Eating your fruits and vegetables, making sure that they're clean, well washed, your salads, having good protein, I think is very important. It's just feeding your body. Important. Exercise. Lots of studies are out there, believe it or not, as tired as you are and as short of breath as you are, if you do little goals of saying, I'm going to walk around this room 5 times, and I'm going to do that every 2 to 3 hours. You're going to build up your stamina. It's going to help with depression. It's going to give you more sense of strength. Put your sneakers on, go to a mall inward when it's cold out, and that you can walk around. But we're definitely seeing a big improvement in patients with MDS that are really struggling with fatigue, that it does decrease and their endurance does pick up if they have little increases in exercise. Continue to enjoy things that you love to live. Get enough rest. Again, you want to try to avoid taking naps in the middle of the day for long periods of time. It's going to throw, your system off. So you can take little naps, listen to your body, try to balance it out. Talk to your doctor, talk to your nurse. You might need some antidepressives. You might need some therapy. And there's breathing techniques, there's different things that can kind of help balance you out, so that you do get enough rest. Very, very important. There's another website that I'm going to show you, but it's Building Blocks of Hope, and you can find a lot of information that's very simple, and it's a downloadable resource that you can see about diet and exercise and what to avoid in terms of infection and bleeding. And we'll go over that. So for fatigue management, like I said, strategies, exercise, adequate sleep, and social interaction. All of this stuff is very, very important to discuss this with your doctor, and then they can prescribe either, like I said, therapy or antidepressants if you need that. But I think breathing techniques and different other non-medicinal things are also very, very effective. Making sure that you're well hydrated. Very important across the board. We don't drink enough, but you don't want to overdrink, but you want to drink just enough, and make sure that that is being looked at as well. Again, making sure that you know the do's and don'ts, and you know that when you have to call your physician if you're running a fever, very, very important. They will prescribe antibiotics if necessary, and that you're compliant in taking that medication as prescribed. And making sure, very important, patients forget this, but again, I addressed this before, but making sure that you speak to the doctor before you make any dental appointments is very, very important. Supportive care we've addressed. We are going to individualize and personalize. We do give patients some breaks after you start a particular therapy. If you wanted to go away, we might be able to give you a holiday, but that's discussed and under advisement. We want to minimize the side effects associated with your therapy. So sometimes you need to, instead of getting the drug every 4 weeks, you might need to have it every 5 weeks. We need your body to be able to recover from the last treatment. So we will work very closely with you, gathering all the information, looking at your symptoms, seeing how you feel. We don't just give you a blood transfusion because you have a low hemoglobin. We give you a blood transfusion if you're symptomatic, meaning you very short of breath. And you have other issues. If you have platelets that are very low, if you're showing some signs of bleeding and things like that, we will make a determination on whether or not you need that. So again, you have to describe to us how you're feeling. It's just not a number. So this was provided to me from the Leukemia Foundation. These are side effects from azacitidine and its impact on your well-being. And what you can see is that a lot of patients did have some constipation, but we know that we give a medicine that helps with the nausea and vomiting, which causes constipation. So it's very important to have that conversation with your healthcare team. Drinking, a good diet, and having stool softeners is very, very important. Having that right up front. And making sure that you're not having a big issue with constipation, because that can cause lots of other problems. But these are just kind of general side effects, but it's very well manageable. For injection site reactions, we do give antihistamines, some creams and lotions. If you're having itching, oral antihistamines also, cool or warm compresses, some acetaminophen. As well. Erythema, it's like, redness around your injection site, but we do have some techniques in terms of giving the injections that minimizes the redness that can occur locally, and you will have bruising because if you have low platelet counts, and so we will hold the injection site for a few minutes and assess you after that. This is, you may have read about that. You read a lot of things on the internet, but primrose oil is something that you can find in a health food store. And this was a study that was published in 2010, very small numbers. It's not going to do any harm, but you can see that there was some redness at the injection site, and patients who apply this topically. I am just pointing it out because I know that you'll probably be reading about this as it relates to azacitidine, and so you can see there's just like a little red dot. It doesn't work on everyone, but it's out there, just so you know. Lenalidomide, since this is available, as you know, is an oral medication. It does, again, also decrease your blood counts. There were some issues with this drug when we were studying it, and for multiple myeloma and high doses of causing blood clots, but this has not been reported in patients with MDS. But when you start this oral medication, it's required that you're having your blood counts checked every week for at least 8 weeks. And you will have associated rashes with this. It's usually mild to moderate, just so that you know. And again, we will treat you with some steroidal cream and some compresses and antihistamines. Diarrhea can occur. Again, we're going to just manage you through that with some medication if necessary, but also give you some tips in terms of foods and diets and things like that will help. Just remember that you just have to let your nurse and your physician know what side effects that you're experiencing, because when you get your medication and you look at the side effect profile, it's like 20 pages long. Because when we do these trials, we have to report every little thing that a person says, my eye wasn't twitching before I started this medication. There it goes, we got to report it. You got twitching eye. So, but the big ones is what we care about. So all of these things are very manageable. All you have to do is just mention it to us. So you become a partner in your care, and you build your own MDS plan that's specific to you. And so Building Blocks of Hope is available at the MDS, and you have this little dash foundation. It's available on iPads. It's available, you download the whole thing. This is a labor of love from a group of nurses that we've worked together for many years. It's an international collaboration. It is being now written in multiple languages across the globe. And it was important to us because, as you can see, what Dr. Silverman had presented, a lot of information. Now we're doing a whole section on mutations. 2 years ago we were, five genes mutations. Now we're in the 40s. What does it all mean? So we want to do something user-friendly there. But what's nice about this booklet is that it is embedded videos. You have videos, you got people talking to you. It's in big print. It's in language that you can understand. It walks you through multiple steps here. This is just a bunch of different questions, but I will show you that, again, like I said, it's very interactive. It's a great resource, lots of hyperlinks. So Australia will be in there, and going to the Leukemia Foundation as well. It's personalized, and there's a section which is called My MDS Plan, and so it's very interactive. You can write down when you were transfused, when your treatment is going to be, when you're going to see the doctor, what your medications are, what side effects are you looking for, and so it's just for yourself. The first one is understanding MDS, just the basics. Again, what's a bone marrow biopsy video, lots of nice things, seeking treatment, how severe is your disease, high risk, low risk disease, transplant, quick tips. This is just guidelines for monitoring and managing your symptoms. That's where we're going to talk about exercise and diet and foods and different things like that. Iron overload. What does it mean? Again, there's also videos showing you iron deposits and things like that. And tab 5 is my MDS plan. And again, it has lots of wonderful tools that'll help you track and manage your disease specific to yourself. And then it has the foundation and a whole host of links and resources that are available for you. Here's some other websites. You have the leukemia.org right here, the aamds.org, and the MDS Foundation that also works with Leukemia Foundation, where it's a big global effort, and they help support these patient groups as well. Every day may not be a good day, but there's something good in every day, and we need to find that. I think that that will help you find balance and just center yourself. And as difficult as it is, MDS research is more exciting than it ever has been by far. We have more good science occurring right now, more than we've ever had. You know, we made lots of strides in the beginning, but Dr. Silverman showed you like 3 slides of how many drugs that we're now that we're studying. And so it is, you know, getting the best out of what you're going to be given. So when you're on azacitidine, don't give up, you know, not thinking that the drug isn't working when you're, you know, struggling the first couple of cycles. You got to get through that in the beginning and then stay on it as long as you can, but then there'll be other options down the road where there wasn't for a long time. So we have hope. There's new treatments. You know, there's things that you can do to improve your quality of life. You've defined what that is for yourself, and we'll help you get there. And it's changing the natural history of the disease, these therapies that we now can offer our patients. This is my grandfather, and so, you know, he's always, when Dr. Silverman would do bone marrows, he was always saying, please do another, figure it out, learn from me, make things better along the way. You help us as much as we help you, and we thank you for your support and your time, and anything that, you know, your doctor or nurse can do, they would want to do. So you just need to, you know, be honest and open with us, and we can hopefully get you there. So I want to thank you very much for having me.